Hey guys, this is gonna be another pregnancy vlog. This one's just gonna be information or questions that I've asked my healthcare provider that she has answered me or stuff like that. First, I want to say that this in no way is um, prenatal care. I'm not a doctor. I'm not a nurse. You need to go to your OBGYN or your healthcare provider or family doctor or whatever to get your prenatal care. This is just for information purposes. Um, I'm not a doctor, like I said, so um, don't use this as an excuse to not go to your um, prenatal visits and checkups and all that stuff. And this goes for all my videos. So some questions that I asked her was, when is it considered safe to not have a miscarriage? And she told me that most miscarriages happen in the first trimester. So if you're going to have one, you're going to have one in the first trimester. Um, and that really at 16 weeks is a really good milestone. At 13 weeks, your chances drastically drop, but at 16 weeks, it's pretty much, you're considered safe, because not long after that, it's considered a stillbirth and not a miscarriage, so that might have some differences. Can I sleep on my stomach? She said that as long as it's comfortable and it's not painful, then you're fine to sleep on your stomach for however long you can, as long as it's not painful and it doesn't hurt. It's okay to sleep on your stomach. How many ultrasounds will I get? Generally, it's two. She said you get one in the beginning for it's called a viable pregnancy, which means that they're just checking to see if the baby has a heartbeat. If you're far enough along, they're just trying to see a heartbeat and make sure that it is viable. And then you get one at roughly around 20 weeks to check development. Around that time, mostly people get their gender verification if they want to know. So it's usually about two. Other than that, you might get more if you're considered high risk, or like if you go to the 3D places that do the 3D 4D ultrasounds. I mean, you can pay to do that um, if you want, but that's not covered through your healthcare provider. Those are elective. Am I, talking about me, at risk for preterm labor? And how do you judge that? Basically, the only way they can count you at risk is if you've gone into preterm labor before. If you've had a premature baby before, there's no like test that they can do. There's nothing like that that they can do that will say yes, you are considered at risk, except for your medical history. Um, and she said that was general for everybody. Being at such a young age, I think I'm pretty healthy, but my medical history does, show for, I might be at risk. And if you watched my first video, I think it was part two, um, I was diagnosed with a threatened miscarriage, and I was put on bed rest, so we're still working on that, bringing down my blood pressure. Um, The next question I asked was, what types of genetic testing can be done, when, and are they safe? This was a big one for me because some people don't want to know, but I want to know. At around in between 15 and 20 weeks, you get what's called um, an AFP test, which basically is a blood test. They just draw blood that tells you if your baby has genetic markers for something like Down syndrome or trisomy 18, um, and a few others. I think there's like open spinal cord syndrome, I think it's called, which is like spina bifida, I think. Hold on. It tests for neural tube defects such as spina bifida, abdominal wall defects, Down syndrome, trisomy 18, Smith-Lemli-Opitz syndrome. That's what it tests for, and that's done between 15 and 20 weeks. It's just a blood test, and it's completely safe for the baby. You want that test to come back negative. You don't want it to be positive. So that's what we're going in for on July 8th to have that done. And from there, if for some reason you do come back positive, there's other tests that they can do. They can do an ultrasound. They can do amniocentesis, chronic villi sampling, stuff like that. So that's something you can talk to your healthcare provider about. The last question I asked was, is constant cramping normal? And I don't mean like cramping like can't move, it's so hard to move. I mean like constant period cramps, it feels like your menstrual cramps. And she said that's very normal early in pregnancy, simply because your uterus and your tendons are all starting to stretch and expand. So it's gonna feel like cramping, but she says it's normal. As long as cramping isn't followed by spotting or bleeding of any kind, then you should be okay. But again, you know, if you feel like something's wrong, you need to call your doctor. You need to, you know, get in there, see them, have them check you, whatever, just to make sure that everything's okay, because, you know, you never know. But that's all the questions I had the last time I talked to her. If you guys have any questions that she might be wondering about that maybe I didn't get to that I had already asked her, go ahead and leave them in a comment, and I will ask her. But again, it doesn't, you know, it's just for information purposes. Maybe you can ask your provider and we can, you know, compare what, you know, what they said or anything like that. So any questions or anything, just leave it a comment, message me, whatever you want to do. Alright, bye guys.